Welcome to The Explainer. So, what happens when a country's healthcare system, the very system that's supposed to save lives, is accused of profiting from sickness? We're diving into an investigation from Papua New Guinea that uncovers a crisis that has failed its citizens on a truly catastrophic level.
Okay, let's just let that sink in for a second. This isn't just some random quote. This is the official, damning verdict from a parliamentary inquiry. They found a system compromised by, and I'm quoting here, complacency, incompetence, design, and/or greed. This really sets the stage for a story of systemic failure with absolutely devastating human consequences.
So how did things get so bad? To figure that out, we're going to follow the evidence laid out in the report. We'll walk through 6 key parts, from the crisis itself to a super controversial contract at the center of it all, and finally, what it might take to actually fix things.
All right, let's kick things off with this central mystery, the real paradox here. How is it that a country with major health funding is seeing its citizens die from diseases that are, well, completely treatable?
The report really zeroes in on one single root cause for this tragic situation, a medical supply chain that is just chronically broken. We're talking about a system so dysfunctional that it consistently fails to get even the most basic medicines to the clinics where people desperately need them. And that question, it takes us right to the heart of the matter. For more than 20 years, one single company, Borneo Pacific Pharmaceuticals, or BPP, has been at the epicenter of this crisis. And that leads us to a pivotal moment that put this entire system under a harsh international spotlight.
Okay, so let's go back to 2013. This was a real turning point. The PNG government decided to take direct control of a massive 71 million kina contract for medical kits. Now, this was a huge deal because that whole process had previously been managed by Australia's aid program and its own trusted suppliers.
Now, the bidding process for this huge contract should have been simple, but it seems to have gone completely off the rails. There was one key rule. Bidders absolutely had to have this global quality certification, ISO 9001. But get this, after all the bids were in, that mandatory requirement was just dropped, poof, gone. And that one little change paved the way for one company to win, BPP, a company that wasn't even accredited.
And if the process didn't already seem questionable, just look at the money. The government picked BPP's bid for 71 million kina. But another company, one that was experienced and fully accredited, had offered to do the exact same job for about 20 million kina less. So, in effect, the government paid millions more for a supplier that didn't even meet the original quality standards.
A decision like that, it's not going to fly under the radar. It didn't just raise eyebrows at home. It triggered an immediate and pretty severe international reaction.
And the fallout was immediate, and I mean really damning. Australia just pulled its funding, saying the tender process wasn't fair or transparent. Their foreign minister even publicly pointed to BPP's history of supplying substandard drugs. This basically confirmed these long-standing worries about BPP's named supplier, NCPG, which a scientific study had already flagged for providing not just substandard but even counterfeit medicines.
And this is why it matters so much. According to the World Health Organization, every single year, tens of thousands of children around the world die from pneumonia simply because the antibiotics they were given were junk. We're not talking about paperwork here. This is literally life and death. So this all begs the question, right? How on earth does a company at the center of so much controversy keep winning these huge contracts? Well, the report points to a powerful web of political influence.
And a big part of the answer seems to be this classic revolving door scenario. You've probably heard of this, right? It's when public officials, the very people who are supposed to be regulating an industry, leave their government jobs and go to work for the companies they used to police.
And you want a textbook example? Look no further. Igo Baru was the top medical supplies official in the entire country, the guy in charge of public procurement. He left his government post, and then just months before BPP landed that massive K71 million contract, he was appointed to its board of directors. You can imagine the kind of invaluable insider knowledge he brought with him.
And you can just see this pattern of alleged influence build over the years. After that 2013 contract, the company's founder gets a knighthood. Then he's appointed chairman of a major hospital, a move critics just blasted as a blatant conflict of interest. And even as recently as 2021, the company got another massive contract, this time by completely bypassing a competitive tender.
You can imagine that knighthood in particular really set people off.
Critics, like the former Prime Minister Sir Macrae Murata, basically said that these kinds of honors were rewarding the exact behavior that should be stopped, not celebrated.
Okay, so with all this public outcry and international condemnation, you'd expect the official inquiries to come back with a clear verdict, right? A straight answer? Well, what happened was the complete opposite. It led to a total failure of accountability.
This is where the story gets, well, honestly, just bizarre. The very same parliamentary committee came out with two completely contradictory findings. In one version, BPP was totally cleared, no evidence of poor performance. But in another version from that same committee, they found extensive corruption that directly linked BPP to medicine shortages. The report itself calls this institutional schizophrenia.
So what happens when you have two completely opposite official stories? You just get this thick fog of confusion. And in that fog, any chance of real accountability, it just vanishes. It allowed this whole cycle of controversy and questionable contracts to just keep on going, totally unchecked.
So after all of that, where do you even begin to fix a system this broken? The good news is, the report doesn't just point out all the problems. It actually lays out a roadmap for how to rebuild the system from the ground up.
And the proposals are pretty sweeping. We're talking about big structural changes. First, you lock in quality by mandating tough international standards for all drug suppliers. Then, you slam the door on backroom deals by getting rid of non-competitive contracts. You create a truly independent regulator, and you enforce strict new conflict of interest laws. And finally, you demand a new, truly independent inquiry, one with real teeth, with the power to actually prosecute.
And really, this is what it all boils down to. The report makes it crystal clear. This isn't just a healthcare problem. Fixing this broken supply chain is one of the most urgent national security and development challenges the country is facing. It's about rebuilding the fundamental trust between a government and its people.
So we've walked through how a system that's designed to save lives can get so twisted at so many different levels. And it leaves us with this one final heavy question. When all the official systems of accountability completely break down, who is ultimately responsible for making sure patients come before profits?